All right, today we're going to dive into a bit of a medical mystery. We're talking about a kind of secret language, these really strange and often misunderstood warning signs our bodies can send out when something is seriously wrong. We're going to unmask what are called paraneoplastic syndromes.
So think about this for a second. What if your body was trying to send you a warning, a really important one, but you just couldn't read the language? You get these symptoms that seem totally random. They pop up out of nowhere. But what if they're not random at all? What if they're all connected, part of one single urgent message?
Okay, so what are these mysterious signals? Let's start with the puzzle itself. We're talking about these really confusing clues that can have both patients and, honestly, even doctors scratching their heads looking for answers.
I mean, take a look at a case like this. You've got memory loss, you've got muscle weakness, and then high blood pressure. At first glance, these things have nothing to do with each other, right? One's about the brain, one's about muscles, and the other is your heart and blood vessels. So how on earth could they be connected? Well, that's exactly the kind of puzzle we're digging into.
And now it's time to pull back the curtain and reveal the culprit. The link, the thing that ties all this together, is something called paraneoplastic syndromes. I know it sounds a little complicated, but the idea behind it is actually pretty direct and honestly fascinating. So here's the absolute key to understanding this. A tumor isn't always just a problem in one spot. It can actually act from a distance. It starts pumping out its own stuff, things like hormones or antibodies, and these substances get into your bloodstream and travel all over, causing all sorts of trouble in places far, far away from the actual tumor.
Yeah, this is such a great way to think about it. Imagine the tumor is like a pirate radio station. It's just blasting out these rogue signals that completely mess with your body's normal communications. It basically hijacks the whole system by broadcasting its own chemical messages, and that's what leads to all this chaos in totally different parts of the body.
And get this isn't some super rare one-in-a-million thing. For folks with lung cancer, for example, these syndromes pop up in roughly 10% of cases. That's 1 in 10. That's a pretty big number, which makes being able to read these secret signals an absolutely vital piece of the puzzle when it comes to diagnosis.
And what's really interesting is that different cancers send out different kinds of signals. It's almost like they have their own unique broadcast frequency. So, small cell lung cancer often sends out signals that mess with your hormones and your nervous system. But non-small cell lung cancer, that's more likely to cause problems with your metabolism. It's like they each leave behind a different kind of fingerprint.
Okay, so the body is sending out all these clues. The big question is, how do we actually decode them? Let's dive in and break down some of the most common signals, and we'll start with the ones that mess with your hormones.
This chart really shows you just how a tumor can go totally rogue. It literally starts acting like an out-of-control gland. It might, for instance, just start pumping out something called antidiuretic hormone, which causes a condition called SIADH. That's what can lead to confusion and fatigue. Or it might churn out another hormone, ACTH, and that gives you Cushing syndrome, with that classic muscle weakness and high blood pressure. Every single one of these syndromes is a direct result of a specific rogue hormone being released by the tumor.
And this is where those pirate radio signals get really dangerous. They start jamming the body's most important network, the nervous system. The tumor can actually trick your own immune system into attacking your nerves. That's what causes a condition called Lambert-Eaton myasthenic syndrome, or LEMS, which leads to some serious muscle weakness. It can even cause memory loss in something called limbic encephalitis. And the key thing to remember is, the problem isn't actually in the brain or the nerves themselves. It's a remote attack, and the tumor is the one giving the orders.
The clues aren't always internal. Sometimes they show up in ways you can actually see. Things like clubbing, which is this really distinct change in the shape of your fingers and nails, or certain skin conditions, can be these telltale outward signs that something is wrong on the inside. And of course, big systemic issues, like a fever that won't go away, or suddenly losing a lot of weight for no reason, those are also part of this whole complex picture.
Okay, so we've looked at the signals, we've talked about the source, but let's get to the bottom line. Why does any of this really matter? Why is understanding all this so incredibly important?
This right here is the most important thing to take away from all of this. That muscle weakness, the confusion, those changes in your skin, a lot of the time these things show up before any of the classic signs of cancer. They aren't the main disease. Think of them as a giant flashing neon sign pointing to a cancer that's still hidden. They are an early warning system, but only if we know how to listen for it.
And this quote really makes the stakes crystal clear. You don't just treat the weird symptom, you have to go after the source of those rogue signals, which is the tumor itself. And that completely changes the game. Think about it. Catching these early warnings can mean getting a diagnosis weeks or even months earlier. That means starting treatment when it has the best chance of working. This is how decoding these signals isn't just a medical curiosity. It can directly impact and even save lives.
When you get right down to it, these syndromes show us something pretty profound. Our bodies are always talking to us. The messages can just be really complex, really subtle sometimes. So the real challenge isn't just about decoding the signals after the fact. It's about paying attention and noticing them in the first place. And that really leaves us with a big, important question. Are we listening closely enough to what our bodies are trying to tell us?